Good afternoon, everyone. I am so happy to be here. The only thing about these webinars is that I'm not able to see everyone, get feedback, but we're just going to have to use this whole high-tech thing to make this conversation work for us. So, again, my name is Leah Brown with A10 Clinical Solutions. Don't worry about all the gibberish that Matt just talked about me. My core is being a woman-owned business. And even though I'm already in the healthcare industry, what really affects me, as it does you as my fellow entrepreneur, is that the cost of healthcare for our employees is rising and rising and rising, and it's almost not manageable. But the first thing I really want to talk to you about as women business owners is that we make up half of the labor force. Women do, and unfortunately, when you're between the ages of late 20s and early 30s, insurance companies have felt that since we're in childbearing years, that we've been a liability to employers, and we actually cost more. However, on the flip side, women business owners employ 35% more people than all Fortune 500 companies put together. So not only are we covering health care for women, but we're also the patients as well. So this is something that we really, really need to get underneath the covers for and to see how we're going to manage this cost. If you see the pie chart that we put together, the cost over health care is unwaveringly different. The majority of it is going to be hospital care. That's the crux of the cost. And, of course, physician services. But on the flip side about it, what's so unique about this is that hospital care is really emergency care. But if you look at the 20% of clinical services with physicians, that's what we're going to concentrate on, because Kay's going to talk about preventive care, and that's how we're going to control these other costs, such as hospital care, nursing homes, home health, prescriptions, et cetera. So it's all going to interrelate together. But again, the number one cost for me, next to payroll, and for most of you out there and all women business owner, are health care insurance costs. And I will tell you, I got really involved with this last year when I got a notice from my insurance company and got a 65% rate increase. I almost fell out, literally, at my desk, and to say, how am I going to come up with an extra $250,000 to pay for the 65% increase? And at the end of the webinar, if you have questions about that, I'll tell you how I avoided that huge pain. But the main thing is that we are looking to control and minimize these costs so that our businesses can thrive. So with all that money spent in healthcare, the key, the secret is we must remain healthy. I don't know if you know this, but in 2000, the year 2000, the U.S. healthcare system, has the highest in cost. We're first in responsiveness, and can you believe it? Only 37th in overall performance, okay? And 72nd by overall level of health care. That's pretty bad for this wonderful country we're supposed to be in. Do you know that our life expectancy is at 76 years, and we are ranked right with Cuba, which is behind us. So we really have to think about how we're going to increase life expectancy, how to increase health care, and increase health care by lowering costs, because it's per person spend on health care is one of the lowest in the world at $186 per person. That's not us. That is not us. We have the worst health care but the highest expenses. We're going to have to change that. Our current healthcare system is not working, as you know. As I shared my experiences, and I'm sure some of you can identify, our premiums are going up. This is hitting directly our bottom line. Our out-of-pocket costs for our employees are escalating, so that means there's less money in their pockets, and employees are coming to work, but they're showing up. But do we really have a well workforce? That's the question that we are going to submit to you. Do you have really a well workforce? And Kay is going to talk a little bit about that.
Thanks, Leah. It's a good overview of the cost of health care today, and that's hitting your bottom line, that's for sure. But what else goes into that whole array of health? We know that healthcare costs, but what's the other cost to not having a healthy workforce? And that has to do with productivity. And that's what we're going to spend just a few minutes talking about. Healthy employees or happy and productive employees. They actually come to work. So from an absenteeism perspective, there's a change. But there's also this whole point about being present and engaged. We often talk about presenteeism, and presenteeism is described about the employee who's present at work but not really fully accounted for. And I'm not going to ask you today for any names, but you probably could just think about that for a second and pull up some of those in your memory bank around some of those people who come to work and you just really kind of wonder about them. That not being engaged costs you. That lost productivity is 7.5 times greater than the cost of absenteeism. And unhealthy employees contribute to that productivity loss at work. So employees who experience illness, low morale, exhibit a poor attitude contribute to the productivity losses at work. Well, why do these folks come to work but yet aren't present? What are the reasons for that? Well, some of the reasons, and let's just do the David Letterman top 10 reasons, really have to do with unsupported cultures. So those policies, benefits, the way work gets done at work just don't support people's ability to take care of themselves well so that they can come in energetic and engaged and fully ready to do their jobs. People don't get enough sleep. We know that they don't. Think about yourselves. How many times have you worked through the night and just on a project that had to be done and something that was due and you just didn't get enough sleep, and then how did you respond the next day? Well, I can tell you, you didn't think as well, that's for sure. People who smoke tend to have problems with concentrating at work. Work-life conflicts because of lack of flexibility. We know that people who have the ability to adjust their schedules so that they have time to take care of themselves, go to the doctor, exercise, eat well, really are much more productive. Episodic health issues such as influenza, so encouraging people to get their flu shots, and it's that season, can really help in working in an office situation for sure. Unmanaged chronic ill health or health conditions, untreated depression, and this is a growing problem, not only just here in the U.S., but around the world. Lack of physical exercise, improper nutrition, which really diminishes energy and fuels this obesity issue. How many times have you skipped a meal and then you hit the coffee to get re-energized? That all takes its toll from a productivity perspective. Too sick, too stressed, or too distracted to be productive. This is a huge problem, and it really amounts to a productivity loss. So employees who spend an average of an hour or almost 2 hours per 8-hour workday on something other than their jobs means that they're being present but not accounted for. And based on those averages, employees' time-wasting cost to U.S. employers about $544 billion in lost productivity. So are you protecting your best asset?
As we know, our employees are our most valuable assets. Some of you may have some inventory, widgets, but we can't get those widgets manufactured or moved around the globe unless we have well, present, and healthy employees. As small women business owners, we must be focused on, one, creating a positive working environment for all. We get so busy sometimes that we mask ourselves from what's going on with our employees. Check in on them. Ask them questions. Observe our valuable assets every day to see if there are any changes in their behavior or in their moods. We must also be focused on creating opportunities for other people and giving employees reasons to feel better as being part of the team. This is something that we think is just an assumption, that we do it as the owners of our business or as the key management team. But with all the dollars being lost to this subject, what we submit to you is stay really focused on this. Some of the things that we're doing to protect them is paying employees better. With the Obama American Jobs Act, there is an incentive, a tax incentive, to pay employees better so that now they can afford gym memberships, better nutritional and perhaps organic foods. So let's put more money into our employees' pockets, and through this, we will get our return on investment. But last but not least is giving better health care for our employees, making sure that the plans are robust and are able to meet all of their wellness, preventive, and sick care needs. The other thing that's important, which is a leader consideration, is that, remember, human capital, again, is our greatest asset. And managing this capital costs us money and resources, so we must invest in them. Health claims and work impairment days are major cost drivers. So health risks increase productivity risks. So if we can manage those health risks, then that stacks the deck for us in terms of minimizing risk. But don't forget your healthy employees. The ones that get up and they jog every single day, they eat well. Don't ignore them, because they need our support to maintain their health, and they also can be role models to other employees. So put them in front of your other staff for other incentives. The rise in aging of employees and the cost of retiree health impacts cost as well. As we know, people have to work longer because of the state of the economy. Hence, it's expected that aging-related costs will rise. So don't forget that you have an aging population within your team. But the key is that health and disability costs can be managed. It can be. And we're going to give you some solutions on how to do that.
So just look around you. Are your employees ready for work today? I hope you don't see anybody with their head on their desk, but could be. Health status is one of the many factors that determine the quality of working time and the quantity of working time, or the quality, which is the productivity of employees. Keeping employees healthy and organizations more productive means that you will be much more profitable in the long run. So having a healthy, productive workforce just really makes good business sense. So we'd like to kind of engage you in taking a management survey. So what we'd like for you to do is go in on the show your little chat box at the top where it says share chat. If you'll just write your thoughts, and we're going to have one of our members of our team kind of calculating the numbers of answers that we get for each question, and we'll talk about these for just a second. So let me ask you the question. Multitasking is an acquired skill, and it's essential for success in today's complex, fast-paced, intensely demanding business environment. Now, do you agree with that statement? Is it true or is it false? And if you'll just write down in that share chat area, we'll be able to see that and can kind of come back to you with what this group on the phone believes. So multitasking, is it really essential for business today? True or false? So just add the share chat. We'll go to the next question. Protecting yourself and others from high stress is an important part of leading and managing your team. So do you believe that as the leader or the manager, do you need to keep other people from being stressed so you take it all? Is that true or false? The next question is talking about investing time. So do you believe that if you invest time in things and people you care about, that gives you harmony and fulfillment? Do you believe that's true, or is that false? Okay. Sustainable health behavior change comes from telling people what their health issues are and how they need to change. So if I tell you what health behavior is an issue, you're going to go out and make those changes. I'm going to stop with this particular slide. We have a few more questions, but let's just answer these before we move on. Multitasking. Oh, we all multitask, but is that really good? Well, the answer really is false. And for most of you, you think that multitasking is really essential for that business environment. Actually, we even hire people that can multitask. Do you ever remember asking someone when they came in for an interview, are you a good multitasker? Well, if you're fully engaged in working on a project, you don't take phone calls, you're not checking your email, but you're really engaged in the project, your productivity is going to be much higher. Doesn't mean you can't have multiple balls in the air. We all do that. But multitasking is the enemy of engagement. Remember that. Protecting yourself and others from high stress, many of you believe that this is true, that you need to do that as a manager, but in fact that's false. All of us experience stress, and we all need to experience some level of stress. But if there's high stress with yourself and your team, let's investigate that. What's going on that makes that happen so that we can mitigate that? Investing time. Oh, we all think if we just invest time in those activities that everyone's going to be happy and harmonious, but actually investing time is not the issue. It's really the quality of my engagement that makes a difference. How many times have you been to one of your children's activities and you're on the phone or you're distracted by talking about other events and you really aren't looking or listening to your child? Well, if you just stop, spend half of the time and be engaged with them, you're going to be much further along the engagement route than others. health behavior, boy, this is great. The answer is false. All of these were false. And many of you believe that if I just tell you what we'll do, what will happen, it'll work. So how many times have you been told to lose weight or to eat better? And you have good intentions, all of us do, but it just doesn't work that way. Understanding what really is important to people, what they value and what motivates them will help that behavior change. And that's essential in helping people to modify their behaviors in order to increase their risk factors. And just for a couple of points, I'll say you can think about these for yourself. Do you actually have any worksite health promotion issues? Do you have programs that you've put in place around having a healthy environment, helping people to eat better, more flexible schedules, having health education programs or benefits tuned to health? If you do, that's wonderful. Are they being utilized is another good question you might think to yourself. And again, if those health promotion initiatives are in place, do you support them by actually participating, or do you just tell others to do that? So again, just a couple of thoughts around leadership and your particular environment you might like to think about. As we begin to talk about health and health in the workplace, we need to look at the culture of an organization. Think about your work, your company. What are the policies that are in place that support people's practices of being healthy? It's important to really understand what those are. We want to think about health and work promotion. We often use the term health promotion. You've probably heard that many times. It's the process of enabling people to increase control over and improve their own health. So this is an individualistic approach to helping people take better care of themselves. But work promotion becomes a really important defining area where success can really be demonstrated. Work promotion then is defined as organizational supports and activities that protect and enhance human capital, that's people, resources, in meaningful employment and thus profits for the organization. So again, having an individualistic approach to health promotion, to promoting health is important, but really success is going to come from work promotion. Helping to understand the organization, how work gets done within a group, and having supports that will enable people to have better health will make a huge difference in really being able to keep people healthy. So again, I think Leah mentioned that earlier, that we want to ensure that we don't forget the healthy employees. Really, approximately 60% of everyone who comes to work is really healthy. They do what they need to do in order to be engaged and come to work and contribute to the organization. And those people are considered low-risk people. But we need to provide work promotion for those people as well, because we don't want them to churn. We don't want them to have health issues and move from that healthy status to where they may have a chronic condition. So I think it's important to always remember that we want to keep healthy people healthy. And then we need to think about people who do have health risks. They can have 2 or more health risks. As they get into having 4 or 5 health risks, we generally call those high-risk people. They incur the highest medical costs. They tend to be absent more. As you might think, they might not be as productive as other people. The health care cost for those people really is much higher. So as the number of health risks increase, as you can think, workers' productivity then decrease. So reducing the risk status of employees will help to reduce those medical costs and improve productivity. So health risks increase productivity risks. We often talk about how do we get information about employees and their health, and one of the best ways to do that is a health risk appraisal or a health risk questionnaire. It's a self-reported kind of questionnaire, but what we have found over the years is that adults actually, when they're asked and they feel that it's asked in a confidential way, will really give you the correct information. We know that diabetes, we know that body mass index or BMIs that are greater than 30, and people who are under general distress have the greatest correlation with low productivity. And from a short-term disability claims perspective, people who have mental health issues and people who have digestive problems have the greatest association with low productivity. And you might think digestive problems, well, that seems kind of strange. But if you think about it, people who have reflux problems or indigestions, that might be really a physical symptom of really having some emotional or distress problem. So let's think about this. What do you do, or how do you get started with a program around taking a look at your health issues and the health costs within your company and making a difference? So taking a look at medical data and what's really driving your health care costs is important. Reviewing policies and benefits, looking at your culture, listening to employees, and really consulting others will be very important. But I think what we'd like to do is kind of share with you what A10 might be able to help you do.
Yes, the first thing I want everyone on the call to think about, maybe tonight, is when, as business owners, we pay for financial audits or financial assessments. We do IT audits and assessments because we want to know, do we have the latest, greatest technology, or are we financially at risk? But we never stop to say, how healthy is our company? And that's what we would like to put in your mind for thought, is to get an assessment of how healthy or sick your assets are, which makes up your corporate health. And in order to do that, and we might be able to help you, it doesn't matter if you use A10 or anyone else, we just want it done, is that you really want to get consultation on your entire staff's health management status. The other thing is assess your culture. Have your culture assessed by someone outside looking in. What do people think about when they come to the office or they're out in there with your customers in terms of their well-being? Review those bottom line cost drivers. We can get to where they are. Many of them are hidden, and you are leaving money on the table that can be put towards your IT because, unfortunately, these hidden costs are within your health care. Partner with yourself and your staff to develop solutions to meet your objectives, and that could be coaching, that can be condition management, leadership courses. There's so many things that you can do. Let me give you an example, really easy, low-cost examples that I implemented in my company internally. We had and we can hopefully send out the video to you. We were a leader in North Carolina Work Well initiative, and it explains many of the things that we did within our company, and that is we adopted an apple a day. We invested in making sure that there are apples or fruits as snacks all throughout our office and accessible to our employees. And if that one apple or that one nutritious snack substitutes something that is not as nutritious, we're moving forward. Very low cost, very easy to implement. And the list goes on. So if you need any ideas, please reach out to us. The person that is responsible for our clinical care area, her name is Kelly Garnett, and Kelly can be reached at kgarnett@a10clinical.com. Feel free to reach out to her about some of the problems that you may be having or opportunities, as we call it, to get your staff healthy and drive those health care costs down so that we can reinvest in our businesses, grow our businesses so we can hire more healthy employees.